My name is Amanda Littlejohn. I'm an occupational therapist, and I specialize in maternal and pelvic health, and I'm also a birth and postpartum doula. I've been working with Women's Advantage here to create a remote postpartum, acute postpartum program. And so right now what that looks like is we developed a program where we're going into the homes for women after they've given birth. So at week 1 after discharge, 1 week after that, and then at weeks 4 and 6, depending on what their needs are, and then an option to add another one if needed. And we're really trying to bridge that gap that's happening in the maternal health care system right now, where we're seeing so many preventable issues happening for the women in our country after they've given birth, and so much that's being missed, and such a lack of support that's happening in the postpartum period, and having this waiting game where it's everything, we're just being told everything's normal and just wait to the 6 weeks unless there's an emergency. But a lot of times people don't know what's normal, and they're left to go home and they feel really uneducated and under-resourced. And so we're really trying to bridge that gap so that they're getting that in-person contact that they need, so that we can help to catch some things earlier to help prevent readmission and give them strategies, as well as to prevent any emergencies that are unfortunately too high and happening too frequently in the United States, as well as giving them just the overall support that you need as a new parent, and resourcing them to not just what pelvic health can provide, but also what is available in our community, and helping them to get plugged into that so that they feel really resourced in the postpartum period.
What has been the biggest impact that you've heard directly from patients?
Yeah, oh gosh, I'll cry if I talk about it too much, but I have a gal that I've actually become very close with, and we worked together throughout her pregnancy in person at the clinic, and then I worked with her in her home postpartum, and she unfortunately had a very traumatic birth, and I was privileged to be a part of, but also was very difficult for everybody involved. And thank goodness it ended with everyone being safe and healthy, but it could have very easily not have gone that way. But at the same time, she was left going home to feel pretty broken, in her own words, right? Left going home to feel like, well, what about me? Like, like, what do I do now? I've gone through this very traumatic experience. I don't want to give too much information because obviously it's private, but physically and emotionally, incredibly taxing experience that she went through. And I've had the privilege to be part of her life for a couple years now. And this year she texted me the week of her child's birthday, and we were able to work together in her home and kind of, obviously I'm not a licensed mental health professional, but as an occupational therapist, I bring in that mental health lens and that we are taught in school, and the behavioral health, and I try and blend that in and mold that into the treatments that I'm providing to people. And so we worked together a lot through what she went through, and she messaged me and was like, this is the week of the traumaversary, right? Is what she called it. And last year, I was not in a good space. This was a very difficult week for me, just knowing what was coming. And this year, because of the work that we've been able to do together, I feel like it's a memory. It doesn't feel like it's still happening to me. It feels like something that it happened, and I've been able to move through it, and that's just something that happened, and now we move on, as opposed to previously it felt like it was still a very active trauma in her life that she was struggling day to day to kind of get through. So for me, when I see people's ability to just be present in their life, that's for me the goal, is can they be present to the things that are most meaningful to them? And that's as an occupational therapist, that's our whole goal, right? It's how do you participate in your meaningful activities every day? And for her, it's showing up for her kids and being present in her family and showing up for her job and feeling good in her body. And there was so many factors that were limiting her to be able to do that. And through our relationship and through that time we were able to work together, helping her to start that path and to kind of start to find back to who she felt like she was before she went through this really traumatic event. So for me, that's the big standout for me. It was that patient.